What was the first signs for you that something's not right?
Oh, trouble in the at the hospital. I mean, I don't remember exactly the examples, but I clearly was not remembering things the way I thought I should. It's interesting because of, I guess, my capabilities and so forth. It's tougher to test a person who's very high functioning and so forth, because you don't see the change, the degradation. I saw it, and there's a lot of evidence now that the patients are the first to know that there's a problem. And so, initially the diagnosis is, mild cognitive impairment. Almost seemed like the doctor was giving me that out of respect for that I noticed something, because testing apparently didn't really show much at that point.
Talk about the ultrasound you're trying to learn.
Right. Okay, so I was trying to learn new technologies, new things to use for the patients in the emergency department. I had a lot of trouble learning new things, and I noticed that. Actually, I noticed that for years, a few years, before I even started really complaining about things. I just wasn't learning new things, which is a hallmark of the disease. It just wasn't sticking. Short-term memory stuff, but especially things that were more challenging, were much harder to pick up. I think I was concerned that the residents that I was teaching in the emergency department and so forth might be noticing things, and I was definitely noticing things, and that's when I started talking about it with my wife. And initially it was, no, that's just aging. Everybody does that. And I said, no, you don't understand. This is different. I'm having problems that are not expected, not normal. And I asked the neurologist that I first saw, can I still practice? Is it safe? And initially, there was a strong yes, it's still safe initially, until further tests and repeat and seeing the change over time that occurred. And then it became very clear that it's just not right you can't practice medicine, certainly not emergency medicine, where split-second timing is important, with a dementia.
Well, it started actually about 1.5 years ago, where we got a suspicion that something was wrong. I was having difficulty with simple tasks, and was becoming more and more agitated and anxious. Last May, we began the long process of determining what was wrong. I was diagnosed with Alzheimer's disease, vascular dementia, and depression in November.
How did that impact you when you got that kind of news, when you were told that?
I wasn't surprised. I knew it already.
What allowed you to know it already?
Because I couldn't remember these things.
And by that time, too, I felt that I was seeing things myself that I knew were not right.
What were you seeing? What were you feeling that said, okay, maybe something's a little off here for me?
I forget stuff that I had heard just a short time before, or certainly like the day after, or I'd make plans in my mind during the evening to do something the next day. Forgot all about it.
It's obvious that it's a progressive kind of a thing, and I've really witnessed that. It kind of starts with little things that you always said or that you always did and so forth, and suddenly they aren't part of your vocabulary anymore, or you don't think in those terms anymore. You know, I guess, and this is kind of guesswork, but as I really think about it now, I really think that all the time there was always a little thing in the back of my mind that said, you're doing things that are beyond you. Other people think more about you than it is really so. And I you know, I dealt with it and whatever, but that always was part of me, and I don't think I really mentally thought of that until relatively recently.
What were the first signs for you?
I didn't notice.
Okay.
I just always had a bad memory, as far as I can remember.
I had the advantage, being in academic medicine, of always working alongside other physicians. They're very busy emergency department, physicians that I was teaching and training and so forth. So there were a lot of checks and balances, which I think probably made it a little bit easier. For me, it was not shades of gray, it was black and white. It's just wrong to practice if you know you have that kind of a problem. And I was not trying to cover it up.
I mean, there are certain signs you can see, things you can feel. So to say that I'm going to ignore it and the diagnosis was wrong, that's a problem.
Yeah. What were you feeling? What were those signs that you were picking up on that there might be something going on?
I was forgetting things very, very quickly. Not one, but more than one. And I still doing it today. I'll probably ask a question 2 or 3 times.